Medical dilemma.
Welcome back to Medical Dilemma. Again, I'd like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center, and LifeQuest Training and Consultancy Corporation. Now, for the start of our third segment, let's go back to the treatment of polyps. Doctor, you mentioned earlier that you can actually take them out endoscopically or by opening up the body.
Yes.
So when do you decide which to do?
Okay, it's going to be here, there's a saying, size matters.
So size, okay.
Size here matters.
Sometimes.
Usually, if the polyp is in centimeters, maybe 1 to 2 centimeters, that's very amenable to endoscopic removal. Meaning you don't have to go through the abdomen, you just go through the endoscope and you remove these large size polyps. 1 to 2 centimeters are already considered large size.
1 to 2 centimeters.
Yeah, usually the polyps that we try to see and discover are less than 1 centimeter. So they're millimeters. So definitely a millimeter size polyp is very easy to remove. Okay, so when they get larger, 1 or 2 cms, we can still remove them. Now sometimes some polyps are what you would call they circumferential. They encase the whole surrounding of the colon, wherein you cannot remove it anymore safely or completely. So only at that time do we call our surgeon to remove that particular part of the colon. That's called colectomy, wherein you remove...
So you removed an entire segment of the colon.
A particular segment of the colon.
Not just the polyp itself.
Not just the polyp itself. Now, if we were to journey further on and say that these polyps can become malignant later on, what usually happens is the endoscopist, us, we will get specimens. They're called biopsy specimens. And we wait for the result of that, because usually at that point, the colon is already seen to be obstructed. It's already closed. The patient is already not able to eat. The abdomen is distended. So we take a biopsy for what we call tissue diagnosis. And it will tell us what the patient has. And then we call the surgeon to do the necessary reconnection or removal, the colectomy.
Can you not have the surgery before getting the results of the test, the biopsy?
The surgeons would usually like to know what they're removing. They'd like to know what it is particularly that they're removing, because the worst thing that can happen is you remove a benign lesion. So they usually need the biopsy specimen. Plus, when we do see a lesion inside the colon, did I say size matters already? Here,
yes, you did.
Looks also matters here.
Looks matter as well.
As well, no? Ang magandang polyp is, how shall we say, arbitrary. Not everybody will agree kung ano yung magandang itsura ng polyp. Pero ang pangit na polyp, everybody can agree. I don't know if you get what I'm saying. You know, pag nakita, everybody knows what pangit is, no? But other people have different ano yung guwapo, kung ano maganda. Pero ang pangit, agree tayo lahat dyan, pangit yan. And when you see that it's pangit, no? And when we mean pangit, I don't know if maybe I could have shown some pictures. When you see it, you will say, hindi yan maganda. You know, it's not a good looking
irregular. Anong color?
Hemorrhagic, friable.
Oh, yeah.
If you'll excuse me, no? Pangit. That's how best you'll describe it.
Know.
So that's the one that is usually seen to be malignant. It's somewhat easy to diagnose that Yung medyo smooth, yung medyo round, yung medyo flat na ano, yon. That can be either or. It can be benign or malignant.
Can a patient insist on having it taken out even before the results are in?
Of course, yes.
Right.
Patients have rights.
Are these rapidly progressing, or you have said it might, between benign to malignancy, how many years?
10 years.
Usually? 10 years.
10 years.
About 10 years.
10 years. It's not
So
that
it's still,
fast.
yes, there's still time.
Even if this already looks ugly.
No, that's different. When it
You have
already
to-
looks ugly,
Yeah,
then you have
operate.
early. You have early cancer there already.
So,
So-
remove as soon as possible.
Right. That means he should have had an endoscope. Like if he had it at 50, he should have had an endoscope at 20 years old,
20
which
years old.
we don't do. You know, you don't
That's
endoscope
right.
the entire
Yes,
population
we don't.
20-year-old. You start only at 50.
Oh.
So, swerte rin if you
But,
develop.
doctor, regarding your practice, the ones who do the endoscopic procedure, etc., they are not necessarily internists.
Um,
Are there also who
should be
practice, for
gastro.
example, well, surgeons who do endoscopy,
yes.
They do that. They do
Oh.
that.
Yes, there are.
cholecystectomy, something like that? Or I don't know.
In some centers abroad, the most prolific or gifted endoscopists are not necessarily internal medicine graduates, but surgeons themselves or
Surgeons.
other specialties. Endoscopy is what you call it's a technical
tool.
skill.
Yeah.
It's a technical skill,
Yeah.
meaning if you've done one, no, you may not be so good, but if you've done 1,000,
Right.
no, you'll get the hang of it and you'll be very good at it. Sanayan lang.
Mhm.
Yun lang yan. You just have to have the numbers, and after a while, most endoscopists can do it in their sleep.
But
What,
okay, go
suppose
ahead,
you're a surgeon, you try to do this for many times. You think that it's necessary to go for a formal study or formal training? Because I've known some.
Okay.
Okay, general surgeons, for example, and they go to this place, let's say Singapore, go there for 3-4 weeks. They come back, they are already endoscopists or something like that. I don't know what you think about it. There could be some ethical issue about it.
Well, in internal medicine people kasi lagi namin kalaban yung mga surgeons.
Right.
Uh, Kami kasi ginagamit namin yung ulo namin, sila ginagamit nila,
Yung kamay.
kamay lang nila eh.
So,
You know,
I think skill is important.
Yeah, you know,
Okay.
although my
Feel
best
comfortable.
friends are surgeons,
Right,
and,
right.
no, and they're a very group, you know, they're a very nice group to know, no. But that has been an impending issue, I think, since the 70s. Surgeons have wanted to do scopes, no?
Okay.
And different institutions, maybe Makati Med, maybe UST, maybe St. Luke's, other institutions, have different rules as to who and when can they do it, how much training do they need, how much certification do they need, or the politics of it. Is it the domain just of the gastroenterologist? As of now, majority of centers limit it only to the GI specialists.
just a G.
There are very few centers that have surgeons who do it.
Don't you think that, the doctor, because you are a specialist, it's high time that we, put centers for training of that here in the Philippines?
There
in
are.
The state, there are already.
There are.
Which is dedicated, most especially for endoscopy and gastroenterology.
Right. Therapeutic endoscopy, as it's called. Therapeutic means you're treating using the scope, no?
Okay.
Has made a lot of advances in the last 10 years. Okay, so much so na 10 years ago, there was no training for it. Now, there are already 2 centers.
Mhm.
So maybe in the next 5 years, there will be more training centers, more trainees who do it. So it's very, very fast. I, for one, was exposed to it. No, when I started out a few years back, the endoscopic procedures were very, very limited. Now, it's very close to surgery already. GI endoscopy, it's almost like you're already going to operate.
Except that you don't open up.
What we call robotic surgery.
That's right.
Can you cover these also?
Okay, the thing about robotic surgery is what they pride themselves in being what they call minimally invasive.
Right.
Only small incisions as compared to large incisions that if you were to operate without the robotics.
Mhm.
So that's the strength of that. Plus, the precision is just as good.
Mhm.
It's just as good. So maybe not for GI specialists yet, no, because there are other techniques that the GI specialists do, no, in other countries, as wide and varied as you can imagine, like removing the gallbladder, for example, removing the gallbladder through the vagina.
Oh, so that's possible.
Mm.
Wow.
They're able to do, an endoscopist can do that.
Really?
Oh, wow.
Wow.
Really.
Ganon ang,
That's good. Yeah, that's minimally invasive, in fact.
Yeah, I don't know why, they were just showing the dexterity of how they can do these
How they
things.
do these
So
things.
the robotic surgery?
No, this is laparoscopic
They
still.
can still do that. Oh my God.
Wow.
So the scopes,
Maybe the OB can go into that also. If that's-
oh, here I think the
that's case.
OBs use robotics to remove myomas now.
Myomas.
Yeah,
They
yeah.
use
But what
robotics.
about the gallbladder? I wouldn't dare.
Not
That's
the
not my line.
gallbladder.
Yeah.
see.
Well, I suppose if it is related to your profession, or maybe you're so vain that you don't want any scar, or you want a small scar, then you would probably opt for the robotic or anything like that.
Plus, recovery is very short also.
But costly, definitely. More costly or
That
what?
factors in, of course.
Yeah.
But that's the trend. That's the trend now where these type of procedures are going. No?
Okay. This condition, bulimia, you mentioned
yes, yes,
Dr.
I mentioned.
Sanchez earlier.
Doc, can you talk about
Do you also
I mean,
cover this condition?
Usually what the symptom will be here is weight loss or inability to gain weight from a certain weight that we usually see in young women. So they usually are brought to us by the parents because they complain that their daughter or son or their relative doesn't seem to be gaining weight or is in fact actively losing weight.
Okay.
despite regular food intake, or
Right.
or they vomit it out, or what? What do they?
So as I mentioned earlier in the first segment, weight loss is an alarm symptom in any age group, and you have to address that. And it's more, I think, still a Western disease. No? Here, ang mga bulimic usually, when they come to us, it's basically because they don't have any food to eat.
Okay,
As
so
opposed
different
to-
circumstances.
As opposed to what you have in bulimia, which is related to low self-esteem. You know, it's a psychological
Disorder.
disorder wherein you don't feel good about yourself, your outward appearance. It's unattractive, and the only way you can make yourself attractive is to lose further weight, which is why you have this aversion towards food. You have a food phobia, or you may eat, but you will
Vomit,
try to
throw it out.
gag and vomit it out. What we basically do for that is we do some blood tests to check for the nutritional status, and then we may opt to take a look inside the organ that's involved, the stomach, at least the stomach.
The stomach.
So we do an endoscopy and then
I
we
see.
check it, everything is okay. And then usually there are the accompanying signs of bulimia, which is called other names. And we might need to call in then our psychiatrist.
Okay. Okay, doctor, thank you so much for all that information. We've reached the end of our segment. So any parting words from Father Jerry?
Well, take care of everything that comes into your stomach or internal organs up to the time that it goes out. Okay?
Yes,
And by the way, as they say that what goes in does not defile, according to the Bible.
Yes,
What goes out
yes.
is the one that defiles
That
a human
defiles
being.
yes.
But just the same, take care of everything that you take into it. As they say, what makes a man is what he takes.
Okay, thank you so much, Father Jerry. Dr. Lilin, final words for our audience?
Again, thank you for inviting me to the show.
Very welcome, doctor.
We'd just like to say that we'd like everyone to, take care of themselves. No, see your friendly gastroenterologist. Have a screening colonoscopy so that we can eradicate colon cancer here in our country.
Okay, and Dr. Sanchez.
As I learned from today's session, anybody can be a victim of health diseases, among others, no? So we should always pray to God, I suppose, to give us a good life here.
Yes,
But we
yes.
have the road to
Amen.
also protect ourselves and maintain our health.
Okay. Thank you so much, Dr. So it really pays to keep one's gastrointestinal tract healthy so that we could enjoy the diverse flavors and spices of life. Thank you for watching Medical Dilemma. Watch us again next Sunday, 6 p.m. here on GNN. You can also catch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis. Be aware and show you care. Have an enlightened week ahead of you. Thank you.
Medical Dilemma